Good afternoon. Welcome to the IUPUI Center for Translating Research into Practice Scholar of the Month Conversation Series. We're so delighted to have you here with us today. My name is Steve Vieweg, and I'm the Associate Director of the Center. And it's a pleasure to welcome you here to this meeting. And I want to share my screen with you to give you some updated information about what's happening here at the center. We're delighted to have with us today Dr. Susana Mariscal. But before we get to that, we'd like to introduce our founders, Chancellor Emeritus Charles Bantz and Professor Emeritus Sandra Petronio. When Dr. Petronio and Dr. Bantz came to campus, they noticed that a lot of the work that happens here at IUPUI is what we call translational. And Sandra was very forceful around creating a center that would recognize, honor, and promote this kind of work that's translational, that uses or generates information and knowledge that can be used to solve complex problems in our community. And when Charles stepped down from being the chancellor, he was the executive director of our center. Now they're both in retirement, and we're carrying on the torch to celebrate and honor this work. And we'll have a chance today to hear from an amazing translational scholar and her colleagues. As we get together, just a reminder, we're all used to using Zoom, but while we're having our initial conversations to hear about information, it's not a conversation, so you can please mute your microphone. You're welcome to leave your cameras on if you like. And at some point, this will become a conversation where we hope that you will turn on your camera, raise your hand, and share a question or comment with us. You may also use the chat box. That's a chance that we'll have to share ideas and information with each other. We have a note here to remind you that you're going to receive an evaluation request of this event. You'll get a follow-up email with a bunch of useful information, including a link. If you'll take a couple of moments to click on that link, answer a couple questions for us, we'd appreciate your feedback about what's happening. That survey link is also in the chat box. You could do it at any time, but at least wait till some of the program's over. We'd like you to stay up to date about what's going on in our center. If you haven't figured out yet, or you're just new to us today, these sessions are available for continuing education units. All you have to do is go to expand.iu.edu and sign up, and you can get credit for attending these sessions for your professional development. We also hope that you'll follow us on your favorite social media to know what's going on. We try to share all kinds of updates and information, hopefully not overwhelming, but you can find your favorite way to do it, whether it's Facebook, X, Instagram, and you can also view our saved recordings of events at the YouTube channel. Our office supports the Bantz community research projects, and you can learn more about those at the website, but we always like to invite people, if they have or they know of folks that are willing to help provide resources that continue this important work, to go ahead and take a scan and to actually make a donation, or let us know if there are people that you think we should be talking to help continue this important work on our campus. Speaking of sharing about work, we are really delighted to have on our campus something called ScholarWorks. And you can go to our website and you'll be able to find our featured scholar page. If you click on there, for example, Dr. Mariscal, you can find all of her easily available at no cost to you journal articles and publications, particularly that relate to her work, just by clicking on a link. You can also go to her page on the ScholarWorks site and see all of our translational scholars and be able to easily access their journal articles. This is a great resource that is available to anybody. So you can refer them to our website if you want to share your great works with them. Upcoming events in November, our Scholar of the Month is featuring Dr. Jennifer Guillano. So please join us November 17th, a little early because of the holiday, but that focus will be on whose history matters, thinking about collaboration and open access. So join us for that. Also, upcoming events, we'll be sharing some information about the Bantz Community Fellowship Award, and you can join us to learn about that in December or January. If you're a faculty and want to know more about what this award is and how to apply, come join us, or you can certainly always give us a call and we'll be happy to answer your questions. But today we are here to converse with Dr. Susana Mariscal, who is in the IU School of Social Work. And as a social worker, I just have to say, I'm so delighted that she's here today. When I first met her, when she came to campus, we both have a keen interest in kids, and we've had robust conversations ever since. I'm delighted that she's here today with her colleagues. And so I'm going to unshare my screen and let her come on board and share her information. And so welcome, Dr. Mariscal.
Well, thank you so much for this invitation, Steve. I really appreciate it. And I thank everybody who's attending, and especially for this recognition as a Scholar of the Month is truly an honor. But I couldn't have done any of this without the wonderful partners that I have, all this fantastic team, my implementation team, and of course, the over 200 partners that are working with us in different communities across Indiana that are making possible and strengthening the supports that families get in the community. So thank you so much. And I would like for my partners to introduce themselves. Do you want to start, Brian? And there is a picture of my son. That's the light of my life. So I just wanted to share that. As Steve mentioned, I am in the School of Social Work, and I am the director of the Strengthening Indiana Families project. And we are, it's a strengths-based primary prevention of maltreatment project that is implementing 4 family resource centers in central Indiana. So Brian, do you want to continue?
Sure. Good afternoon, everyone. My name is Brian Victor. I first met Dr. Mariscal, Susie, on my very first day as a faculty member in the School of Social Work at IUPUI, and have been kind of thrilled to have been brought along on a journey with her ever since, for really thinking critically about prevention and how to support families at all levels of kind of the social environment, and have been pleased to work alongside her on the Strengthening Indiana Families project since its inception.
And the next would be Jill.
Hello, everyone. Good morning. I'm Jill Kelly. I'm one of the vice presidents at Firefly Children and Family Alliance. I manage all of our prevention programs, which is Community Partners for Child Safety, and our family resource centers. I guess I'd like to say I met Susie when she drugged me to Washington, D.C., and we're sitting in this room, and she's telling me all about these family resource centers in her dream. And then I suddenly realized I was the one that was going to help her open them. So that's always my funny story about her, because I was looking around going, who's your implementation partner? And she was like, you. So I was kind of a little bit slow on the story, but it's been a real joy, helping her with this vision and her dream, and it's really come to fruition. So thank you.
Amazing. You've been so wonderful, and I frankly can't imagine this coming to pass, to make those dreams a reality without you. And the same thing with Hannah. So Hannah has been an instrumental partner. Would you like to introduce yourself, Hannah, please?
Sure. I'm Hannah Robinson. I am the prevention manager at the Indiana Department of Child Services, and my team is responsible for administration and oversight for all of the prevention programming, child abuse and neglect prevention programming that is funded by the agency. And I first met Susana when being asked to participate as a member of the steering committee for the Strengthening Indiana Families project. And she's been great to work with.
Oh, thank you. Thank you so much. So Janie, would you like to introduce yourself?
Yes, good morning, everybody. My name is Janie, and I am the CIV project coordinator, and I get to work with Dr. Mariscal, who we call Susie often, and she is just an inspiration to me to the field of social work about how far you can go in the field, beyond homes, beyond classrooms, and just truly have implementing work. So it's a pleasure to be here today.
Thank you so much. And I want to acknowledge all my partners that are here, like Valerie Morales from the Department of Child Services. I have Jamie Smith from the Department of Health, Peggy Welch. She's been such a wonderful champion. She's from FSSA. She's been such a wonderful champion from the get-go, and I appreciate everything she's done. The same thing with Ashley Crumbach. She's from the Department of Child Services too. And she was like instrumental in getting the 25 letters of support first for the grant, so like the grant application. So many of you, and I see many other partners. So thank you all for being here, and thank you so much for your support as well. I just want to go back to the title of the presentation and why are we talking today about strengths-based prevention? And when we talk about strengths-based prevention, we are talking about this approach to prevention practices that focuses on developing protective factors and skills to live better lives. So we're going to be focusing on the tenets that are the three T's. So it's tailor, tie-in, and toward. We are talking about tailored services that respond to the uniqueness, the unique needs, and the unique strengths that we can find in individuals, families, and communities. We're going to be considering cultural and developmental factors. We're going to be considering the strengths that those families and individuals and communities have. When we say tie-in, we're talking about collective impact. We're talking about the fact that when you work together with other prevention initiatives, even if they're not targeting necessarily the same outcomes that you want, like we're not talking about prevention necessarily child maltreatment prevention, but you're talking about, for instance, substance abuse prevention. You're talking about homelessness prevention. You're talking about services that are going to be increasing support for children and families in the community. It doesn't matter where you're coming from. The idea is that you're working toward an intended result that is improving the lives of children and families in that community. So tying those efforts not just maximizes the resources, but also really maximizes the collective impact that each one of you can have in different areas. And when we talk about the domains of strengths that we're going to be targeting through those tailored strategies or tie-in initiatives, we're talking about regulatory, interpersonal, and meaning-making strengths. So instead of thinking of protective factors as an umbrella, like the umbrella that you see on your screens, we're going to be thinking of it more like an army Swiss knife. Like we're going to try to get people to have many more skills, like sort of MacGyver. I don't know if you know MacGyver, if you've ever watched a MacGyver episode, but the idea is we want to develop so many skills: resourcefulness, creativity, support, social skills that families can overcome and face and thrive through adversity. So I think that now, Brian, you can move it to the next slide, please.
Sure.
All righty.
Thanks, Susie. So I think what we were hoping to do today is just to have a bit more of an informal conversation and think about kind of situating Dr. Mariscal's work with strengthening Indiana families within the broader context of the prevention infrastructure and prevention programming that the state of Indiana has been developing over the past 20 or so years now, or 30 or so years at this point. And so maybe just to start that conversation, I'm going to invite Hannah to give us just a brief kind of history of Indiana's practice of really engaging in a lot of that translating research into practice, a lot of thinking about how different programming has been piloted, and then the state has decided to scale that up and really implement it in a way that's been to the benefit of Indiana families. So Hannah, can you just give us a brief history of kind of the pre-2019 era in terms of prevention within the state of Indiana?
Sure. So I think that prevention really started to be funded by the Department of Child Services in 1993. And that is when we first piloted the Healthy Families Indiana program, which is a home visiting program that's available to expecting families and those with infants that are not yet 3 months of age. We then kind of saw the impact of that program and decided to expand and fund the Healthy Families Indiana program statewide in 1994. And then we continued to fund that program and fund it today, even after the Department of Child Services became a standalone agency, kind of branching off from the Family and Social Services Administration, which we were a part of when we first piloted Healthy Families Indiana in 1993. We then kind of saw the need to invest in additional prevention programming in around 2006, when we created the Community Partners for Child Safety program. And that actually originated when DCS was seeing a lot of families that were assessed by child welfare that had needs but did not rise to the level of needing formal intervention. So we actually piloted that program in 2006 in Marion County. And then after seeing how successful that was at connecting families to needed supports and resources in the community, we expanded that statewide in 2007. And we're still funding that program today. I don't know if Joe wants to tell us a little bit more about the Community Partners for Child Safety program.
Sure. So it's a community-based program that DCS pays for, that is for preventing child abuse and neglect. But we don't tell our families that DCS pays for it or that it's necessarily for that. What we try to say is, what do you need help with? How can we help? Anybody can get services. The only thing you have to have is a child in the home under 18. So we do home-based services. We do community-based services. We do budgeting, parenting, parent cafes. We do lots of primary prevention through that program, including safety events, car seat safety, safe sleep, back to school events. I mean, it's really changed a lot over the years. I would say it started out to be more one-on-one with families for at-risk families. And now I think it's really more widely available across the state because we want to catch families where they're at. So if there's something that they need that we can provide that will keep them out of the system, there's an agency in all 92 counties that can provide that service. Firefly has it in 33, but there's 4 other agencies that provide the same service. And one thing I like to say about this, I've traveled a lot in the last couple of years to learn about family resource centers. And the one big difference between Indiana and some of the other states is our partnership with DCS. I just was in Phoenix yesterday at Thriving Families, Safer Children, which is a whole nother task or process or whatever that we're working through. And DCS isn't at the table very much. So it's really, people see DCS one way and don't even realize how much money they're putting towards prevention and helping kids stay together and helping kids and families stay in their homes.
Thanks, Hannah and Jill. I just think it's a great example of some of the prerequisites for really translating research into practice is to have community partners and funders and policymakers at the table who see the value of that research and can then help to scale it up. And so when it comes to the area of child maltreatment prevention, Indiana has a long history of this practice of piloting things, of critically examining that evidence, and then having the implementation expertise to really bring it to bear across the state. So I think that brings us to 2019. And for those who are maybe outside of the child welfare field, 2018 was kind of a major inflection point and kind of signified a real kind of national shift where not only are we thinking about child welfare as kind of a responsive or child welfare practice as a response to abuse and neglect, but really now starting to think about how do we effectively use evidence to promote the prevention, the primary prevention of child maltreatment. There was major federal legislation that was passed, the Families First Act, that has now created a Title IV clearinghouse of evidence-based practices to promote prevent child maltreatment. But we're also in kind of the early phases of conducting that research and then helping to move it into the field. And so Susie and I have often dubbed it the age of prevention, that we're moving into kind of a new a new kind of this new moment when there is both the interest for implementation and increasingly federal funding to explore and implement new prevention strategies. So I just want to kind of set that context and turn it over to Susie to kind of talk to us about the origins of strengthening Indiana families, that it happens within this context of a broader national shift towards prevention. So Susie, maybe can you just share with us kind of the thinking, the research you've been interested in prior to that point, and then when this federal grant opportunity came, why you knew this was the opportunity to really bring a lot of that, to move a lot of that, these pieces from research into practice.
Perfect. So thank you, Brian. So I was new to the state, as Brian said. I came in 2018, so I didn't have a lot of connections, but when this opportunity came, one of my colleagues at the School of Social Work made a connection with the Department of Child Services with Heather Keston, and we were able to meet, and it was 3 of us. So it was the School of Social Work, DCS, and the Department of Health. And we started thinking about how we could respond to this opportunity, because it required 9 systems to be involved. It required primary child maltreatment prevention strategies, and it required a lot of work, right? It needed to be researched, rigorous research, but also it required evidence-based practices. And in the field of primary prevention, there isn't a lot of, evidence-based practices with randomized controlled trials and all that. That exists more for secondary and tertiary type of prevention efforts, but not for primary. So I started my career working on child sexual abuse prevention, and I developed a program in my country. I developed a child maltreatment prevention program in my country, also based on resilience and the UNICEF Children's Bill of Rights. And I had been working all my life around strengths and resilience, and it was for me coming full circle, right? Like to try and think, how would I do this? And I would do, after all what I learned around mental health services, working with youth aging out of foster care, what are the supports that you want to provide to families so that the kids can be safe, and their well-being, the trajectory of the whole family can move towards well-being and the fulfillment of the children's promise. So that's why my partners talk about my dreams, because I allowed myself to dream, and that's how I describe that process. I allowed myself to dream and to dream big. What would I do if I had all the money? What would I do if there are no restrictions? Thinking about what works and looking at different areas. I looked at public health strategies. I looked at mental health strategies. And I had worked with Promotoras de Salud, so I incorporated the Promotoras de Salud model. So we have community navigators. I thought about the Family Resource Center as, promoting protective factors. So thinking about, how do I strengthen the connection between parents and kids? Let's make sure that one is the first thing that we are working on. So we have family fun events, monthly family fun events to do that, to provide parents that opportunity to sit back and relax. But when we were writing this proposal, we needed to bring all of these other systems, and we did bring them. And as I said, Ashley helped us, with other partners getting much more support. But there was a clear need. We got involved in non-traditional partners like the library, parks and recreation. We involved multiple partners that were, for example, mental health providers, the Y. A variety of partners that were interested in what we were proposing, because we were thinking of not just promoting the protective factors in the families, but also thinking of making the communities more supportive of families. So because there is too much isolation, families are moving and they don't have necessarily the support from family members or extended family or friends. So when there is more isolation, there is more risk. And, thinking about what research has identified as risk factors, I started thinking about that. And when I proposed the model, people responded really well. By the time of the application, we had the 9 systems that were required and then some, right? And now we have over 200 partners, but because we're working at a different scale. Yes.
And Susie, maybe that's a nice way to transition and have maybe Janie, if you could kind of explain what that model looks like. So,
Yes.
right, this funding opportunity from the U.S. Children's Bureau came down. Susie secured that grant, proposed these family resource centers, brought together multiple stakeholders to envision what those would look like. And so can you talk to us or give us kind of the highlights for what is a family resource center? What are some of the core components? What is that? What's kind of the thinking behind that?
Yeah, I will just start. As you can see on the timeline, a big part of the Family Resource Center started when CIP did a needs assessment to find out to partners and community members, what does the community need? What would it look like to have services directly in the community that help the families that the CIP grant was intended to target? And so we also thought about the principles of our model, which is to be relationship first, data informed, building upon family strengths. And some of the things what that ends up looking like in a family resource center is to have co-located services. So instead of families seeking out placements throughout the community for help, they can come directly to the Family Resource Center and get connected to programs that are in their community right at the source. So instead of traveling to an office, maybe to sign up for Head Start is at the Family Resource Center. So we are eliminating families having to go to different doors, and then also giving them education to about programs such as Healthy Families, community partners, other things that are going on. And when you go into the Family Resource Center, we are creating a space where we're building a relationship with families because it's a place where you can come back more than once. So it's not meant to just satisfy one need of a family, but to be longstanding in the community so that as your family grows, expands, experiences new things, you can always come back to the Family Resource Center and we will have a way to serve you. That is what I would say is what you would get when you walk in. You get a personal greeting by someone who is from the community, they live in the community, they know about it, and then they're able to make direct connections to those resources that family needs. And the goal is that this is all done before the family interacts with DCS so that at the resource center, we're able to stop whatever may start when it comes to abuse and neglect.
We also have different levels of intervention, right? So we have the macro level that is we have a campaign, a public campaign that is public awareness campaign that is a digital campaign. Kids don't come with instructions, we're here to help, because we identify that stigma is a big problem. That's why we also have the family resource centers in spaces that families feel comfortable at, right? Like, so we have one of our family resource centers is in a neighborhood, and it's, a standalone building. 2 others are in churches. So it's really bringing, making it easier for families to attend. And also, we have a variety of services. In addition to concrete supports, we provide take and make meals, we provide diapers and formula, safety items, but we also provide a window between worlds that is a trauma-informed and arts-based program. And that we're also, it's another, part of the translation of research into practice. Like we're really testing that one and evaluating the feasibility of implementation. We also have recovery supports, and we have a variety of co-located services, but no center looks exactly the same, and no better than, I don't think that anybody can describe that better than Jill. Because
Exactly. So if Susie is the chief dreamer and the chief architect of this model and of these centers, then Jill is certainly the chief builder for bringing them into.
Jill is the dream maker. Yes.
Right. As Susie affectionately refers to it, the dream maker. Exactly. So Jill, something that kind of looms large on this timeline too is this dotted red line for the COVID-19 lockdown. And so you gave us the anecdote about finding out that you were the implementing partner just before this happened. So can you maybe talk to us about this task of taking these evidence-informed ideas, but then bringing them into reality within the various communities? Just kind of talk us through that process of getting the centers established.
Sure. I think it was, well, it was COVID. I mean, literally, we got back from Washington, D.C. and everything shut down. So we had this idea, and then we didn't really have a great way to start because everything was closed. So we had a year, which really was, I think, critical in terms of building the community collaboration. I think one of the biggest benefits we've had, aside from all the support that the families get, is that the communities are working together so much better since we have an FRC. So we had a year of build up to that. But even when we opened in January of 2021, we had to do drive-through events still. So I think the other big challenge was trying to find a place to have them, because the grant did not provide funding for bricks and mortar. So I had to find partners that would let us have space for free. And I had to leverage some of the funding through our community partner program. Firefly was chosen to do these FRCs because of the location. We were the prevention provider. So it was kind of a natural fit. And also then we could move some of our funding around, and the money we were already spending on primary prevention, we could use and help build up the family resource centers. So, I mean, it took us a year to get a building, to figure out how to get furniture and all of those things. And then we opened the first two in January of 2021. So it was a good process, and it sure taught me a lot for the next two and then the next two. And we keep changing how we're doing it as we do it, because each community is a little bit different. Each community responds differently, and the time in the world is different. And I think that affects how we open them as well.
Yes.
That's great. I think it's a great example. I mean, in the intro, Susie gave us a framework for strength-based prevention, and part of that is tying various prevention initiatives together. And I think the family resource centers are both a great location for doing some of that tying work, but you can also see that when you have the implementation expertise built up over years and years that Jill and the folks at Firefly have, with a supportive partner like Hannah, that you can really braid together a lot of those funding streams to bring these evidence-based initiatives into the field and really get them implemented. I wonder if, and this might be a question for the group, if you could just share some of the, what you see as some of the big wins over the past years of the grant, some of the things maybe you're most proud of that's been accomplished since these centers launched.
I mean, to see the centers, for me, it's just like completely overwhelming. Every time I go to the center, I'm just blown away by the amazing work that our implementation team is doing. I mean, like, they go so far beyond what we initially expected or proposed, because, for instance, family fun events, great. You're thinking, I mean, I was thinking, game night, we just have some board games and something easy, to do. But they set up incredible things, movie nights where they get even chairs donated for kids to have, experience, and popcorn and the whole thing. Okay, they do, for example, the prom, say yes to the dress. So they got prom dresses, and they got even a photo booth and hair and makeup and everything for her girls. So it's just amazing to see how the communities are taking ownership of the family resource centers, and how they see themselves as not just the designers, but how they're going to make every center better. I just love to see that commitment among our partners. We have parents who are also part of our advisory council, and it's just amazing to see how they all, parents in the community, everybody we talk that goes to the center feels that kind of not just connection to the center, but a sense of ownership too.
Great. Well, I do. I'm sure we can keep talking and have other pieces to mention or share, including the kind of sustainability of this model beyond the grant. But maybe Steve, is this a nice time for us to open up for questions to the group, or
Yes.
it would be great to hear from folks if this resonates, how maybe some of this aligns with your own work. So we'd certainly welcome questions.
So this is your chance, audience. You can turn on your camera, unmute, raise your hand, put it in the comment. They'd love to hear your thoughts about this or questions.
Good morning. I'm Shirley Alexander. Thank you for the presentation. Where are your centers located? How do you choose the locations?
Yes, so we are located, so the 4 centers that we opened are in Delaware, Grant, Madison, and Tipton counties. And we decided to we decided to implement family resource centers in those counties because those counties have a lot of risk factors for child maltreatment prevention. So we have a lot of child poverty, we have a lot of unemployment, and other factors that would contribute, like in what research associates as risk factors. Those were identified. However, we even looked within the counties and identified the zip codes with a higher prevalence of foster care entry, and that's where we located each of the centers. So, and we are now tracking where people come, like the guests that come to the family resource centers, where they are from, what their zip codes are. And we're seeing that we're actually serving the population, the people that we wanted to serve, those that may be experiencing higher risk for maltreatment. Now we are expanding, and we didn't say anything of that, Hannah. The state will be expanding, and they will be taking over the sustainability of the centers. So they will be providing funding for the centers once the grant ends. But they have already opened 2 additional centers this year. And that's why I was talking about Jill knowing all the details, because Jill is providing the technical assistance for the new centers that are opening. And they are located in LaPorte, Wayne. Those 2 are the 2 counties that have opened it already. And we have 3 others that are working to open it this year. It's Elkhart County, Tippecanoe, and Clark County. Anything else that you want to add, Hannah or Jill?
I'll just share that Tippecanoe is actually opened on Monday, I believe, this week. So they're actually open now.
Fantastic.
We have a question in the chat, Susie, so I'll read it out loud. It says, what are some of the challenges in evaluating this endeavor, and how are you addressing them?
Oh my God, it is very hard to evaluate such a complex program, but also evaluating prevention is harder in itself, because how do you evaluate something that hasn't happened, right? So we do have outcome evaluation and process evaluation, and Brian is actually our evaluator, like the lead evaluator of the project. So Brian, do you want to describe a little some of the challenges?
Sure, I can just speak real briefly to that. I mean, some of the challenges in terms of evaluation are often around dosage. How do you know the impact of the family resource centers when folks come at really varying times? We've tried to capture that a bit in some of our follow-up survey data. We usually administer a baseline survey when folks come to the centers for the very first time, and then we follow up with them 6 months later and ask, number of times that they visited, looking to see if in the kind of short term, there's any impact on protective factors that Susie had mentioned at the beginning. But we're also looking at community level impact, because as Jill noted, as Susie noted, that this intervention has not just been about this program is not just about the family resource centers themselves, but it's about improving collaboration among various service providers, innovating in ways that families are able to access those supports beyond what the family resource center offers itself, like family fun events. So we're going to use a quasi-experimental design and just look over time to see if the rates of maltreatment reports, rates of foster care entry have declined within these target communities, and we'll be using some synthetic cohort design to construct a comparison for that. So those are some of the kind of higher level pieces on the evaluation. But one of the things we're also most kind of dedicated to is telling the stories around this. That is talking with people who've come to those centers, understanding how this works, how this might be different, and really using that as we move forward to support the state in continuing to implement family resource centers.
Yeah, and the follow-up question is, who gets to decide what constitutes success? And basically it will be measured, looking at the foster care entry rates. And we have not calculated that necessarily for the counties overall, but just looking at the numbers, some of our counties had 75% decrease in foster care entry numbers, not the rates, but the numbers. And around 46% overall in our target area. So it's really exciting. However, in case, the intervention effects can be diluted, we are also using pre-test, post-test, sort of like a follow-up after 6 months of that initial connection with the family resource center. So we do intakes, and we're collecting a variety of protective factors, some risk factors there too, so that we can assess the change across time. But not with everybody. So you can say how many families we have so far, Brian, because I know that we already met our goal.
Oh, yeah. Within the 6-month follow-up, are you saying, Susie? Yeah.
Yes.
We'll have about 300 families that completed baseline and then follow up.
Mm-hmm. Yes, and so far we've had over 24,000 visits to the centers, and we're talking about 3 years, right? 3 years of since they opened in 2021. So, and we don't necessarily open 8 hours a day or every day in the week. It's limited hours. And about 3 to 4 days a week. So it is amazing the response of the community. There is a question: how has the process? How has the process been in finding and getting funding support for the programs? Has it been easy, challenging? So we got a 2.7. So it was about $2.75 million grant for 5 years, and this is from the Children's Bureau, the Administration for Children and Families. That is the funding that allowed us to do this research. Now, this was not the only source. As Jill said, I did not plan for rent or insurance or utilities. So that was my fault. And I did not plan for that because I thought, we will find churches that will want to do this. And that's how I did it before in other states, but I didn't have all the connections here. So it was a little more challenging. However, and that's where Hannah comes in, and not just Hannah, but all the leadership in DCS supported us and allowed us to, align different sources of funding so that we could have more support. So there is additional support from DCS. There has been additional support since we opened. So Jill, you can say more about that.
Yeah, I was just going to put it in the chat. I think we've been doing we have a team at Firefly that's been applying for grants through the community foundations in the area. Some of the private funders, like at corporations. We even have some coming through the United Way. So I think as we're working closer to sustainability and we have more data of the number of people, the number of families, it's easier to apply. So we're definitely working towards that, along with our continued partnership with the Department of Child Services.
Yes, so we received grants for example, from the Tipton Community Foundation, from the Grant County Foundation, and different things here and there. But that is something, for instance, I get to support Jill's team around that, but I'm not the applicant, right? That's directly for services, and it's actually an organization, like a nonprofit organization that needs to apply for that. So it's them who apply. So it's again, collaboration, using the strengths and the talents that each of us has, and for the purpose, for our goal, for our end goal, right? So, and same thing with Hannah, like when we were looking of where to expand, again, I can provide support where I can, right? Like to identify the risk factors, the communities with higher risk, and I can provide input around that. But they're the ones that have a vision. And I gotta say, we had amazing champions that allowed us and expanded our voices, so created opportunities for us to be able to talk to leadership, to policymakers, and the support also from policymakers that really are committed to prevention and, supporting, increasing the supports for families.
I'd like to ask another question, and forgive me if it's rambling, but I very much appreciate the work that you're doing. Being the wife of a pastor of an inner city church, we saw so many struggling families. Is there any way that you could share your data about how to, the best I could describe it is like maybe churches, particularly inner city churches, could become satellites, or can you share data or implementation strategies that would work with families? That wasn't real clear, but
yes, and the answer is like, the more support that there is in the community, the better for the families, right? So the more resources, and that's why we have these teams that are local teams where we try to identify who else is doing what, so that first, we're not duplicating unnecessary things, but then families get as much support as possible, right? So if we know that there isn't a lot of resources in this other neighborhood or in this other area of the city, then to bring resources there to try to create more opportunities. And Nuri's question is the end goal to have a family resource center in every Indiana county? Yes, that would be the final hope. That's the dream. That's our vision, right? A strong and caring communities throughout Indiana where families can equitably access the resources they need to be connected and safe. And yes, that would be it. But I see Peggy, showing her video, and that reminded me, Shirley, that there is the 211 also that has a lot of resources and information on supports. And Hannah, if you want to just say that the warm line is coming.
Sure, and we have kind of paused on that, but we have taken over the Department of Child Services has taken over the 1-800 children line that was previously housed under Prevent Child Abuse Indiana to use to connect families that need help with connecting to resources and supports in their local communities, to be connected directly to our Community Partners for Child Safety program, which our community partners agencies are also the local implementing agencies for the family resource centers in our state. So Susie referenced earlier that we had, plans for expansion. We've already expanded to 3 additional counties this year. And those family resource centers are housed under our other, some of our other community partners for child safety agencies. And those include Geminis, SCAN, Bauer Family Resources, and Ireland Home-Based Services.
Wow. I want to say that this is an excellent example of what we hope would happen when we engage in what we call translational research here at IUPUI, where we use generated knowledge to solve complex problems. And what we're hearing is how that is happening across lots of levels. At the systemic level, where agencies are partnering together to figure out resources make sense, how to sustain that. And then we have Ms. Shirley Alexander come and saying, here at the local level, how do we engage with this and how do we make a difference? And it takes all of that to make these sort of things happen. And so thank you all for taking the time to share with us and to engage and to get us thinking about it and finding new partnerships. So I do want to pause, Susie, and say Well,
Go
I just want to say that we know that people have to head off to other places. We'll continue to stay here for a little bit to have the conversation and do a final. But we know if you have to leave, we understand so that you can get to your top of the hour activity. We thank you for coming. Hope you'll join us again. But I do want to give Susie a chance to say, here's a final thought before you might jump off.
Yeah, I wanted to share, to respond because Shirley says, please send me the information, but anybody, if you scroll a little up, I shared 3 links. There we have our Meet Project report with all the data. I am sharing also the website for the Strengthening Indiana Families that has our model, our vision, and also the services specifically for each of the centers. And also our YouTube channel that not just talks about what each center offers, but also our model and philosophy. So I hope that that helps. And my email, I'm writing it so you can, if.
Well, and as you're writing that, we will send out from our office a follow-up email with all of this information in there as well. So if you don't get to capture it from the Zoom chat today, know that it will come to your email along with that invitation to do a quick survey about your experience here today, but know that you can access Susie's email, the reports that she suggested, as well as other resources. So we'll make that our official end, but we will stay on. For those of you that still want to carry on the conversation for a little bit, we're here, but if not, thank you for coming today. Please join us again in November and keep doing great work. So thank you to our amazing team today. Thank you for sharing.
And thank you for this honor.